Welcome back to Studio 701. It's North Dakota Suicide Prevention Week, and I'm joined by Cora Doctor. Thanks for being here, Cora.
You're welcome.
Now, you are the chairperson of the North Dakota Suicide Prevention Coalition. So, first of all, you have a personal reason to be involved with the coalition. You have faced this tragedy head on, as so many North Dakotans have. Will you please just share us a little bit about your son, Steve?
Yeah. Our son died about 6 years ago. Well, 6 years ago. He was a hardworking a father, a husband, a Christian, and really strong, held to his faith. And he'd helped so many others, and no one had expected that he would be the one dying. And so that was one of the hardest parts. It's good that you hear the good stories, but you hear the, we never knew. And so that is the part that scares me with what I'm doing now, because this is a silent and lonely disease. And until we start talking about it and recognizing it as a disease, nothing's going to change, and people are just going to die.
And we're certainly trying to bring awareness to it this week, especially. Now, how soon after you lost him did you start working for the Suicide Prevention Coalition?
Well, it took a couple years, and I'm a nurse. My background is in nursing, and I got to the point where I looked back and realized everything that went wrong in his hospital stay, and that should not be happening in this day and time. And so it took me a couple of years. I got his medical records, and then it was basically divine intervention, because God kept on putting people in front of me. And it was like, okay, I can no longer ignore this. I've got the background in my nursing career to make a difference, and I need to do that, because I did not want to, but it makes a difference for people that have gone through it, to be able to make that difference for other people. And that's our goal, is to make a difference for people in North Dakota.
Such a tragedy that you've been through.
Yeah.
What have you gotten from knowing that you were doing that and helping other families and being part of the Prevention Coalition?
You know, we can't get our son back, but we can prevent people from having to go through the tragedy that we relive day after day after day. Because when you lose a child tragically to something that they were not able to discuss, that never goes away. And so being able to make a difference at a higher level, at a state level, at a systems level, gives me great joy, knowing that we can make changes for everybody in North Dakota at any age. We're looking at all generations. We're covering all generations in North Dakota is our goal population.
Yeah, well, you're doing a wonderful thing, and we want to continue these difficult conversations. So, Jeff, let's talk about more with Allison now, with the North Dakota Suicide Prevention Coalition. Jeff, take it away.
That's right. I'm here with Allison Trainer, also with the North Dakota Suicide Prevention Coalition. Thank you for being here, Allison. Now, Allison, 2020 has been an unprecedented year, and there are lots of people struggling with mental health. How important is it for North Dakotans to be aware of suicide prevention?
Oh, it is more important now than ever. We know that North Dakota's suicide rate had increased more than any other state in the country before COVID-19. Now, in our highly rural state, we're really experiencing a lot more risk factors that we didn't experience before. All the challenges we had previously, whether it was parenting stressors with losing employment, stressors with all the life issues that take place, those things haven't stopped. But now we have the social isolation, increased economic stressors, and political challenges. So there's all sorts of pieces that can be stressful. And so we want to prioritize mental health every day, not just on Suicide Prevention Month, but right now it's more important than ever to certainly check in on those folks that we're worried about and to get involved in suicide prevention.
And I know that the suicide numbers were trending upward in January. What else would you say has impacted, with the pandemic, has impacted perhaps suicide? And what can some things people could be looking out for with suicide to help prevent that.
Absolutely. Well, certainly with the pandemic, we have absolutely seen an increase in isolation. People reaching out on even the COVID-19 hotline saying that they are feeling isolated and they just want someone to talk to. But we generally just want people to note that if they're worried about someone, to think suicide first, because suicide is a matter of life and death. All the other things can kind of wait. But so what we recommend is to ask folks directly about suicide or tell someone who's not afraid to ask. But I think it's not as important what you say as that you reach out, that you send that text or that you make that phone call. Face-to-face contact, of course, is always best, but right now that can be a challenge. So we also recommend Zooming or, you know, that video, Skyping, whatever it is that folks use, their preferred application to reach out and to say, hey, you know, I've been thinking about you. One way that we ask or talk to folks is say, you know, I know you've been through a lot lately. I've been thinking about you. Have you been thinking about suicide, or have you thought of suicide? If you're not comfortable with that question, that's okay. Talk to someone who is, bring in a third party, or call the Lifeline.
Okay.
The Lifeline is answered locally right here in North Dakota and by FirstLink. So that's another partner at the Suicide Prevention Coalition. We are a broad-based coalition. So we include partners like the Crisis Line that answers the National Suicide Prevention Crisis Line, FirstLink, as well as the American Foundation for Suicide Prevention.
Great. So much good information, Allison. Thank you so much for being here. For more information, go to ndspc.org. Also, the Suicide Prevention Lifeline at 1-800-273-TALK. Coming up next, let's talk about many more